Hello friends, let's see the basic difference between the skeletal muscle, smooth muscle and the cardiac muscle. As far as the undergraduate student is concerned, this topic is very much important for the examination, whether in case of the theory or practical, this topic is frequently asked. When we see the site of the skeletal muscle it is situated within the limbs, within the body wall, in the tongue, pharynx as well as the upper part of the esophagus. While the smooth muscles, they are present within the lower part of esophagus, gastrointestinal tract, urinary system, genital system, as well as it is also situated within the blood vessels. Cardiac muscle, it is situated within the wall of the heart. When we see the shape of the skeletal muscle in this figure, we can see it is cylindrical in shape. In case of the smooth muscle, it is a spindle shaped cell, and the cardiac muscle, it is a short and cylindrical in shape. Skeletal muscle having no branching pattern, smooth muscle also do not have branching pattern, while the cardiac muscle having a branching pattern. So this is the branching pattern of the cardiac muscle. When we see the nucleus of the skeletal muscle, they are situated in the peripheral part and they are multinucleated cells, while the smooth muscle having a centrally placed single nuclei, while the cardiac muscle also having a single nucleus which is situated in the center part. The cell membrane of the skeletal muscle it is called as a sarcolemma, while in case of the smooth muscle and the cardiac muscle they are called as the plasmolemma. Light and the dark bands are present within the skeletal muscle and cardiac muscle, while it is absent in case of the smooth muscle. And these light and dark bands they are because of the actin and the myosin filaments present within the skeletal muscle and cardiac muscle. Intercalated disc is the cardinal feature of the cardiac muscle which is absent in case of the skeleton and the smooth muscle. Skeleton muscle it is supplied by the somatic nerves while the smooth and the cardiac muscles they are going to be supplied by autonomic nerves. In case of the blood supply, the skeleton muscle and the cardiac muscle both having abundant amount of the blood supply while the smooth muscle having a very scanty amount of blood supply. When we see the contraction speed of the skeletal muscle, it is very rapid contraction is there in case of the skeletal muscle, while in case of the smooth muscle, a slow rhythmical contraction is there, while in case of the cardiac muscle, rapid contraction is there. Skeletal muscle get fatigue easily because of the very rapid contraction, while the smooth muscle they do not get fatigue easily, while the cardiac muscle they never get fatigue. Skeletal muscle they are voluntary in nature, they are under control of the individual because of the somatic innervation, while the smooth and the cardiac muscle they are involuntary in nature because of the autonomic innervation.